When you're in liver failure, the waist measurement will go from normal, like 32, to 52 or 62 within a day.
You are kidding.
You swell up like a toad. And that's what I've seen. It's horrible because when the liver fails, your whole body fails. And so it's critical to catch this at an early stage. Hello, Dr. Colbert here. And have you been given a bad report on your liver? Well, you know, knowing the number of your liver functions is the 8th major number you need to know. And we're going to tell you how to restore your liver, and it's real simple. A report that we know is that the main cause of cirrhosis or liver failure is number 1, alcoholic liver disease. Number 2, the second leading cause of cirrhosis or liver failure is viral hepatitis. But the third leading cause of liver failure cirrhosis is a fatty liver. And 25% of Americans have a fatty liver, and 5 to 10% of children have a fatty liver. Now, this was not the case years ago, but now, due to the excessive amount of sugar, processed foods, and bad fats, and standard American diet, we are destroying our livers, our filters.
Dad, this is going to be a great show. Welcome back to Dr. Colbert's broadcast. I'm here with my mom, Mary, my dad, Dr. Colbert. Today, we're going to be talking about liver. You need to know your liver enzyme
Numbers, what are they?
What are they? What do we do? And how do we fix it?
Well, your numbers are this. You want to have your ALT and AST at 35 or less. Those are your main liver numbers you need to know.
Say that last one again.
Your AST and ALT. The ALT is the most important liver test. And you want to have those numbers at 35 or less is the key. And so when those numbers are high, you tend to have fatty liver. But let me tell you this, if your liver functions are elevated and your hsCRP is elevated, then you're more prone to have non-alcoholic steatohepatitis, which is, it leads to cirrhosis faster. So when those two numbers are high, you're in trouble. And you should have a FibroScan or an MR, magnetic resonance elastography, to see if you're developing fibrosis of your liver. See, the liver goes through stages. First, it starts with fatty liver, but with increased inflammation or elevated hsCRP, that inflammation leads to fibrosis of the liver, where it's minor fibrosis, and then it leads to major fibrosis, then it leads to cirrhosis or liver failure. When you're in liver failure, the waist measurement will go from normal, like 32, to 52 or 62 within a day.
You are kidding.
You swell up like a toad. And that's what I've seen. It's horrible because when the liver fails, your whole body fails. And so it's critical to catch this at an early stage because we're seeing even fatty liver in our children. 5 to 10% of children.
And that is happening mainly because of high fructose corn syrup.
High fructose corn syrup, sugar, just sugar, 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 processed foods, white bread, white flour, grits, potatoes, anything processed raises the sugar level, as well as bad fats, inflammatory fats like hydrogenated fats, French fries, greases, even seed oils. They will also contribute to the fatty liver, but especially sugar. Fruit juices. You know what the worst sugars are for the liver?
You just told us fruit juices.
Fruit juices, dried fruit, honey, maple syrup. And people say, but I love it. Pancakes with honey and maple syrup on it. Oh my goodness, that really gums up the liver.
Okay, well,
you're damaging your liver.
All right, I know people's brains are just blowing up right here at this point. So when you're young, there is a lot you can get away with.
Yeah, you can.
And
you can.
When you're developing and the children are growing, they can put the maple syrup on their pancakes. And so I want people to get a balance here so that they understand. What happens is when you do it a lot, over and over again, it's part of your daily diet, that's when you're in trouble.
Major trouble, and you start to get a fatty liver. So again, you have to understand the foods that are pushing us toward the fatty liver, and it's the foods that spike the sugar. In fact, your diabetics and pre-diabetics are the ones that literally have the most of this that I see in my patient clientele.
Does activity influence this at all? Like these kids that are
Oh,
getting obese early.
well, they
Is
can
some of
burn.
it due to inactivity?
Well, absolutely. The more obesity people have, generally the less activity they participate in, because the more active you are, you're burning the belly fat off. The more belly fat you have, the greater your risk of fatty liver. Actually, metabolic syndrome, which includes visceral fat or belly fat and high blood pressure and high triglycerides and elevated fasting blood sugar, insulin resistance, those four, which is metabolic syndrome. 35% of Americans have metabolic syndrome. They're at the highest risk of fatty liver. But also the diabetics and pre-diabetics are at a high risk of fatty liver. And people that just follow the standard American diet are at a high risk of developing fatty liver. And realize 25% of American adults have fatty liver. I see it almost every day in my practice. 25%. One quarter of people have fatty liver.
Right now
Yes.
in America.
And here's the caveat. If your HSCRP is elevated and your liver enzymes are elevated, you're in trouble. You're pushing your liver toward fibrosis and cirrhosis. So it's critically important for those people to get further because in a lot of my patients, I do, test the magnetic resonant elastography, which measures the amount of fibrosis you have in your liver, or a fibroscan, which is an ultrasound test that measures the amount of fibrosis in your liver.
What is fibrosis?
Fibrosis is the stage right before cirrhosis. Right before the liver fails, it goes through fibrosis, where it's forming fibrous tissue. It's destroying the architecture and destroying the parenchyma of the liver.
It's like a
fibrous tissue. And so the liver is shriveling up, is shrinking. As the cells die, fibrous tissue takes over. And so once it reaches cirrhosis stage, it's all scarred and little teeny. The liver that's the size of a football is shrunken down to the size of like a small cantaloupe or something. And so these people, literally, when that happens, they get the spleen enlarges. They get tremendous edema in their abdomen, ascites, with all this fluid accumulates in the abdomen. They swell up, their legs swell up. Their swelling comes all the way up their thighs and their abdomen, and they gain like 50 to 100 pounds within a day or two.
But
And then
those
they
are
have
some early symptoms
Yeah.
when they're starting to swell.
Oh, when you're starting to swell, those are late symptoms.
Those are late
That means your liver's in failure.
Early symptoms are probably more
Well,
type 2 diabetes related.
Well, no, you get tired. You don't have that many symptoms when your liver's in the early stages of health.
Wow.
That's the problem.
The blood
You just
test,
get
though,
tired.
the blood
because
test comes up.
These people are tired. They have a little twinge and a little bit of pain in the liver, but many times there's no symptoms at all.
Wow.
But they're exhausted. These people are tired. They're obese. They don't have any energy at all. But you got to know your filters. That's why I check these filters every 6 months on my
The
patient.
filter numbers.
The filter numbers, your liver, your ALT and your AST, those numbers need to be 35 or less. And as long as they're at that stage, they're generally okay. But once they're over 40, you're getting in trouble. When they go up higher, if they're up to 75, 100, you're in trouble. If they're 200, you're in dire trouble.
So many people think you could just get a fatty liver through alcohol.
Well, you can, but that's the number one cause of cirrhosis in this country is alcohol. That's why I don't drink a drop, because I've seen too many people who've destroyed their livers from alcohol, and young people. They may be in their 40s and 50s, and now they're dead through cirrhosis of the liver.
The one reason we are doing these programs is because we believe God wants you to live long and live strong. He doesn't want you to get to the point in your life you need a liver transplant.
Yes, exactly.
That is not his perfect plan. He has a plan for you that he wants you to live long and strong for not just your children, but your grandchildren, to live so that you see your great-grandchildren. That is the will of God, for you to live long and strong. That's why we're doing these programs, to give you this information. Please take this information. Don't just listen to it and walk away and pretend, well, I'm just going to believe God. Because what you can do, he will not do. God's into partnership. God's into partnering with you on your health. It's not God's best that you need a miracle. God's best is that you walk in divine health. That's why we call this company Divine Health, because that is God's best, is that
That's right.
you walk in divine health. Now, Don, what are some things that they can be very active right now to do to reverse this?
Well, first of all, let me just explain this. The liver has over 500 household duties and it needs to do every single day. Like some of you women are in your house and you don't have the energy or the time, so your dishes build up, and so you have dishes in the sink. Then eventually it spills over and your trash, you don't have the energy to empty your trash can.
Have you been?
And then you haven't had time to vacuum your house. So eventually trash builds up in your house. The liver is like your main filter in your body.
That's good, Doc.
Your liver
That's a
filters out
good analogy.
toxins. You see, every time you drink tap water, you're getting even meds that are flushed that end up in our groundwater. You're getting Prozac. You're getting birth control pills, guys. You're getting all kinds of medicines like antibiotics in it. You're getting heavy metals when you drink water, or tap water.
So
You're
if you
getting
have a well,
pesticides,
if you have a well,
herbicides.
forget drinking that water from the well water. You think you're getting, or you're getting bad water.
You're getting toxic water,
toxic
but your liver has 500 duties that it does.
Yeah.
It actually helps to break down our sugar into energy so we can utilize it. Breaks down our proteins and assembles proteins throughout our body to restore our body. See, about 90% of our body is being restored every year based on the foods that we eat, but from the proteins that come from the liver. The liver is important for blood clotting. It performs the clotting factors that clots the blood. People whose livers are start to fade, they start bleeding and oozing out.
And bruising real bad.
Yes. And it also is important for producing bile. Bile helps you break down fats. So these people can't digest fats well. When they eat fats, it just runs through them. And they start to get irritable bowel, and they start to get diarrhea and things like that. That's because the liver is not functioning right.
Do they get bloating or indigestion?
Yes, bloating and indigestion commonly, because the bile is important in breaking down these fats. And that's one of the major duties of the bile in the liver is to produce the bile that breaks down the fats. So the bile is.
I always thought that was the gallbladder.
Well, the gallbladder's used too with that. So you get
So
the
if you
signal.
lost your gallbladder, you've got to have more of a function.
Well, again, you're still producing bile. The liver produces the bile. The gallbladder stores the bile.
Oh,
So
okay.
then when you eat fat, you release a hormone, cholecystokinin, that causes the gallbladder to contract, and that bile is secreted into the small intestines to break down the fats. That's how God designed it.
Okay.
It's amazing. We're fearfully and wonderfully made.
So you need
But-
your gallbladder.
You do. But what happens is so many of us gum up our gallbladder. And most gallstones and sludge is formed from high cholesterol, from butter, cheese, cream, coconut oil, fried foods, hydrogenated fats, and fatty meats, bacon, sausage, steaks, burgers, pepperonis. These gum up the gallbladder and create sludge in there and stones in there. Okay, but so they are interrelated. But an elevated AST and ALT are usually the key signs that you got a fatty liver. If your HSCRP is elevated over 3, you're in trouble. You are actually inflaming your liver and pushing it toward fibrosis and cirrhosis. So in that case, you'd want to get a further test done, which is the FibroScan or the MR elastography test of the MRI of the liver to show that.
So what are some things that we can do if we're feeling sluggish and we're not breaking down fats and we haven't lived a healthy lifestyle? Chances are our liver's not in great condition. We want to get it healthy.
Well, if you're obese or if you have the metabolic syndrome, like we talked about, you need to get on the Beyond Keto diet. I wrote a book on this, or the Healthy Mediterranean or Keto Zone, and just limit your saturated fats, and then you'll start burning that fat. Practice intermittent fasting. And then Nano-Glutathione is wonderful for protecting the liver. Glutathione's great. If a person has liver problems, fibrosis, cirrhosis, I'll give them IV glutathione 2 or 3 days a week. But also what I do is I use that high phenolic olive oil. I'll use these high phenolic olive. It's a whole new classification. That helps the liver tremendously, the high phenolic and oleocanthal olive oils, as well as our liver gallbladder cleanse. This has the milk thistle in it. It's got the alpha-lipoic acid in it. It has the beetroot extract that helps the artichoke that helps to support the liver. So this, along with the Nano-Glutathione, is wonderful for your liver.
Let me
Helps with fatty liver.
just add something here for those of you that are watching. Let me tell you what separates Dr. Colbert my husband from your average doctor out there giving nutritional advice. He's a practicing physician. He sees patients.
Yes.
He has his own results that he sees. He's a researcher. He spends hours and hours on the weekends and at night, late at night, early in the morning. And if he's not doing that, Kyle's doing that, in which they are researching and looking for.
With AI too. We're using the AI technology, which is
Some
great.
of it we are. Some of it we're just using the old line school. I watch you pulling the books and the studies. The point that I'm making is there's a lot of people out there that may give conflicting advice. And a lot of them are not even practicing physicians. So they don't really know except from hearing from somebody else. He's learning firsthand from what he's doing with his patients and people that we know and that we see the results. So that's why we can be so confident in what we say and what we do.
So how do we reverse it? So let's
Okay.
tell them how to reverse it. It's real simple.
Because you've done it, so let's tell them.
Well, first of all, you've got to quit eating the very foods that invited it in, and it's the high sugars. The honey that we talked about, the maple syrup, the sweet dried fruits, the raisins, the prunes, the figs, the dates. These are real high in sugar. And the fruit juices, I don't drink fruit juice. We go out to eat, the first thing they bring to the table is bread. And we say, no, don't bring any bread. And then the last thing they want to give us is the dessert list. I say, no, forget the dessert list. We skip that. Skip the bread, skip the dessert list, eat healthy carbohydrate, eat a big salad with olive oil on it, have a lean grilled meat, chicken and fish and turkey's the best, occasionally red meat, and then have your vegetables. Like I'll get grilled asparagus, I'll get green beans. Now a little bit of times I'll eat some brown rice, but again, that's good in moderation. But again,
that's some people don't know brown rice can even spike your blood sugar.
Too much. That's why you only want less than a quarter cup, and wild rice has a lower glycemic index than brown rice. So if there's wild rice, get a little wild rice, but not too much. Anytime I'll go get rice and chicken and hummus at this Greek restaurant, they'll give me a huge amount of rice. So I'll split it down the middle and I'll push it onto another plate and I won't even eat that because I'll just eat so much. Okay, so again, if you have too much, you're going to increase your sugar and you're going to literally stress your liver. So we want to protect these filters. So the big thing you want to do too is you want to, of course, follow the low carb diet, low sugar diet, the Beyond Keto. You want to practice intermittent fasting. You want to exercise. Exercise is extremely good in helping you burn these fats off. You want to increase your fiber. Fiber, anytime you eat carbs, it's good to balance it with fiber, either high fiber foods or fiber supplement like Fiberzone. So after dinner, I go home and I'll have my heaping scoop of fiber in 4 ounces of cold water, and that literally slows down the absorption of sugars. Then you can have your nuts. Your nuts are really good for fiber, and then avoid alcohol. And then the supplements are glutathione spray, as well as your liver gallbladder cleanse. And then don't forget, if you're obese, use those GLP agonists like the Mount Gero, the Zepbound, the tirzepatide. Those are amazing for fatty liver.
The fat shots.
They help to get rid of fatty liver.
Yeah.
Absolutely. I have corrected a lot of fatty liver with those.
Wow. So the GLP-1,
they're wonderful for that.
Great benefit.
Absolutely.
They do.
Okay.
They do.
If you are interested in any of these nutritional products, go to divinehealth.com. You can also go to Amazon. It's also found on target.com. And so you just type in nano glutathione. We have it in a convenient spray.
Now, if they have liver issues, we go from 4 to 7 or 8 sprays twice a day.
Okay.
And that really supports the liver, as well as the liver gallbladder cleanse. We use 2 capsules twice a day, typically.
Okay, so 7 to 8 sprays if you're having issues. So if you're having some of these symptoms, you're feeling fatigued, you're not breaking down fats, chances could be that you're having some issues with your liver and gallbladder. So nanoglutathione, we also have it in a dropper form. So if you like the drops, you can drop this in water if you prefer, but it's got a nice little kind of cherry flavor.
Yeah, our nanoglutathione, I really enjoy it. I take it every day. I swear by that. It'll help. It helps the liver tremendously. It supports a healthy liver.
It is. It's great. And so in 2 caps a day for the liver gallbladder.
2 caps twice a day. And then once their liver functions normal, drop down to 1 twice a day.
Now, and if you're having gallbladder problems and you're
that helps tremendously.
Yes, because I've got so many girlfriends that I do know they'd get on our, they were concerned because they'd get the pains on the side, and they're like, Mary, it works.
They get
it
that
works."
right upper quadrant pain right here, and after they eat something fatty, they hurt right here. And I touch this one acupressure point right here, and they come off the table and say, "Don't do that." I said, "I'm barely touching it." I said, "That's your gallbladder point." It's like showing that you've got a major issue going on with your gallbladder.
Well, this has been a great show, Dad. Number 8, get your liver and gallbladder.
Know your numbers, know filters.
Know your filter number, know your liver number. We'll see you in the next show. We are going to be talking about, I'm not going to tell them.
Your next filter.
You're just going to have to watch. We'll see you next time.